Hi, my name is Laura Jones. I'm one of the nurse practitioners that works at the LSU Student Health Center. Welcome to the GYN Wellness class. Our hope is that this class will provide you with information on what to expect during your annual exam and information you need to make decisions about your health. Your annual exam is basically a visit to see your healthcare provider once a year for your healthcare needs. We follow the American College of Obstetricians and Gynecologists recommendations on what your exam will consist of. Before your visit, you will fill out a questionnaire about your personal, medical, and sexual history. This form will be available to you after you schedule your appointment. After you arrive, the nurse will measure your weight, heart rate, and blood pressure. You will also need to know the first day of your last menstrual cycle. After the nurse obtains this information, she will bring you to an exam room for you to talk with the provider. You will be fully clothed at this time. You and the provider will discuss the goals of your visit, for example, contraceptives to regulate your menstrual cycle, or to prevent pregnancy, or help with acne, or even all three. We can discuss types of birth control and or any problems you may be having. After this discussion, you will be asked to get undressed. Depending on your age, you may only have to get undressed from the waist down. If you are under the age of 21, you will not need a pap smear, but will have an examination of your vulva and vagina and, if needed, an STI screen as well. If you are 21 years old, you will need a full exam, including a pap and a bimanual exam. The position for the pap seems quite awkward at first, but be assured we will walk you through and help you to feel comfortable. If, according to the guidelines, you need a pap smear, the picture can give you a good idea of what to expect. The pap brush, as you can see in the picture, actually swabs your cervix and collects cells that are sent to the pathologist. The pathologist will determine whether the cells are normal or abnormal. After the pap, you will have a bimanual exam, which is where the provider feels for your ovaries and uterus to make sure that they are normal size. So how does contraception work? Most work by preventing ovulation and affecting the cervical mucus. Some benefits of contraception include cycle regulation, less cramping, shorter and lighter periods, some improve acne, and some decrease your risk of ovarian cysts and ovarian cancer. So let's talk about some common misconceptions. For example, weight gain. Most birth control methods, specifically the birth control pill, does not typically cause weight gain. However, I always say everybody's body reacts differently. There are a few methods that weight gain is a possibility, but we always discuss this before prescribing. Birth control does not cause infertility or birth defects. You do not need to take a break from birth control, and women over 35 can take the pill. A big misconception is that you don't need to use a condom if you're on the pill. If you do not know whether your partner has a sexually transmitted infection, you always need to use a condom or dental dam. So you can just look at this slide. You can see in the left-hand column if there is perfect use, which means if you do not miss any pills, or if you do not forget to make your partner wear a condom, versus typical use, shown in the right-hand column, when you do forget to take a pill, or you don't insist that your partner wears a condom, that the chance of pregnancy is a lot higher. You can see that the implant, which is an Nexplanon, is the most reliable method, and that's because it has no reliance on you for it to work. And of course, if you look at the very bottom and see if no method is used, 85% of women become pregnant after 1 year. So let's talk about the birth control pill. This is the most popular form of contraception and is also used by people that don't have sex or have sex with the same partner, for menstrual regulation, to improve acne, and reduce cramps. It's also popular because it's affordable, especially for students who don't have insurance or choose not to use their insurance. There are many different types of pills. During your annual visit, based on your history and desire, we will discuss the right pill for you. Some people cannot take combination birth control pills. In this case, we can prescribe a mini pill or the progesterone-only pill for them, or choose a different method, such as the IUD or implant. The patch is a good option for those that don't want to take a pill every day. You replace the patch weekly. There are some disadvantages, such as it is visible and it is not as effective in women weighing over 198 pounds. It can also be expensive without insurance. The NuvaRing is another great option. However, it can be pricey as well. It is a small plastic ring that you insert into your vagina and leave in for 3 weeks. You then take it out a week and have your period. Some people say they can feel it during intercourse, but this is rare. Depo-Provera is an injectable hormone with progesterone only. This is another good option in people with contraindications to combination birth control. A lot of women stop having a period on Depo, which is not harmful to the body at all. You receive an injection every 11 to 13 weeks. The disadvantage to this is sometimes you have irregular bleeding, and a lot of women do gain weight with Depo. The Nexplanon is a small rod that is implanted inside of your upper arm. It is progestin only and provides birth control for 3 years. This is the most effective method we have and is covered by most insurance. The most common disadvantage is irregular or heavy bleeding, which can occur in approximately 20% of patients. IUDs are becoming more and more popular. There are IUDs with hormones and without hormones. You can see that it is a small T-shaped device that is placed into your uterus through your cervix. On this slide, you will see the different types of IUDs, and when you come in for your visit, if you're interested in IUDs, we will discuss further and find the one that is best for you. The next slide shows a comparison of the Paragard, the Skyla, Liletta, and Mirena and Kylena. Some contain hormones and some don't. Some are effective for 3 years and some are effective for 10 years. We often choose the Mirena simply because it has more hormones, so our patients usually have a better bleeding pattern. It can reduce bleeding by 90% after 6 months, which a lot of patients like. How well does birth control work? As you can see from the chart, the Nexplanon, which is the implant in the arm, and the IUD, which is the device placed in the uterus, are very effective. Next is the pill patch, the ring, and Depo. What doesn't work so well is the withdrawal method, the diaphragm, condom use, and keeping track of your fertility and abstaining when you're ovulating. If you are not using any birth control and have sex, there are 3 forms of emergency contraception. The number 1 is Paragard. However, we do not insert these in the Student Health Center for emergency contraception. It takes too long to get approval from insurance to do this, and we do not keep them in stock. Ella is a pill for women who weigh between 165 and 195 pounds. It is not as effective for women over 195 pounds. It is available by prescription only. Plan B is recommended for women who weigh 165 pounds or less and is available at most pharmacies without a prescription. Welcome to the sexually transmitted infection portion of the GYN class. There are several different types of sexually transmitted infections. Some are bacterial, such as chlamydia, gonorrhea, syphilis, and are treated with antibiotics. Some are parasitic, such as pubic lice and scabies and trichomoniasis, and are treated with topical medications. And some are viral infections like HPV, herpes, hepatitis B, and HIV, which can be controlled but remain in your body for life. Human papillomavirus, or HPV, is one of the most common and highly contagious infections that people get. Even condoms don't guarantee that you won't get it because it can be passed with skin-to-skin contact. It can also be asymptomatic for many months or years, so you should never blame it on your current partner if you do get this, unless your current partner is the only partner you have ever been with. HPV usually presents with painless lesions on or around your vagina. Certain strains can also cause cervical cancer, which is why we do pap smear screening starting at age 21. You can also have oral HPV. Many strains of HPV can be prevented through a vaccine called Gardasil. We will ask you if you had this vaccine at each annual visit. Chlamydia is ranked number 2 in the state of Louisiana, and this is the most common STI we see in the GYN clinic. You can get this through sexual contact such as vaginal sex, oral sex, and anal sex. 75% of females that get this have no symptoms at all. That's why the CDC recommends testing for anyone 25 years and younger or with a new sexual partner. Left untreated, chlamydia can cause infertility. Treatment is an antibiotic. Louisiana ranks number 7 in primary and secondary syphilis. Syphilis is transmitted through sexual contact and typically presents as a painless sore on your genitalia. However, it can also occur on or in your mouth. If untreated, it can progress to heart and neurological problems. Treatment is an antibiotic. Gonorrhea is definitely on the rise. Louisiana is ranked number 5 in the nation. Unfortunately, we have seen a lot more of this bacterial infection in the GYN clinic recently. 75% of women have no symptoms. If you do have symptoms, it is usually a yellow or white discharge. Left unchecked, it can also cause heart and joint problems and infertility. Treatment for gonorrhea is an antibiotic. There are 2 different types of herpes, type 1 and type 2. We used to see type 1 mostly on the mouth, but now we're also seeing it on the genitalia because more people are having oral sex. This infection is not always prevented through condom use because there is some skin-to-skin transmission. Herpes can be controlled with antivirals, but you will have it for the rest of your life. Baton Rouge is 5th in the nation for HIV cases. It can be transmitted through blood, semen, vaginal secretions, breast milk, urine, and feces. It is a devastating disease to get. However, more people are living longer and longer with antiviral medications. We do offer free HIV testing when you come in for your annual exam. This is a sexual exposure chart. Find the number of partners, which is on the left of the slide, that you have had sex with, and assume they've had the same number of partners as you. Next, look at the number to the right. This is how many people you have been exposed to. The higher the number, the greater risk of STIs. The last thing I want to talk about is a Lighthouse program. This program is at LSU for survivors of sexual assault, victims of stalking, and dating and domestic violence, which occur all too often. I just want you to be mindful as a student. Protect yourself when you go out. Have a friend that will be accountable with you. Sexual assault often happens in an off-campus apartment or dorm room, by an acquaintance or even a date. Alcohol is often involved, so please just be careful. If you are a victim of sexual assault or you have a friend that is, please know that you can reach out to our Lighthouse program at any time, and we will help connect you to the proper support services. I hope you learned something in this presentation. We look forward to seeing you for your annual exam. Please go online to make your appointment, and if you have any problems, just give our front desk employees a call. Thanks again for listening.